Welcome to another interview video today about hair transplant surgery. Today's topic is kind of someone is suffering from both front and crown baldness. If such kind of patients walks into the consultation, uh, what are their goals? What are their expectations? If we attempt to do transplant in such patients in one session, so what are the pros and cons? That's what we are going to discuss today with a live patient example. Here most of the patients when they walk in to the transplantation details who are suffering from both front and crown baldness, irrespective of the Norwood's classification, we are discussing this here. So such kind of patients, they would always expect to get it done transplant in one session. So how do we handle them? What are the pros and cons in such patients? We're going to in detail discussion today. Kindly watch the video to understand more information on such cases. When someone looking for the transplantation, usually patients wouldn't understand the baldness extent and kind of classifications what are they suffering from. All the way they know it kind of Norwood's classification 1 to 7, and they'll be calculating their baldness in the perspective of Norwood's classification. But and most of the time it's not going to be useful for treatment plan. That means to say, some guys will have frontal baldness and crown baldness, but when they walk into the consultation, they would expect they want to get it fixed with the transplantation, both front and crown area in one session. That's what their goal is supposed to be, and that's what their goals are. So, here when we talk about these kind of patients, there are a few points we need to be considered from the patient aspects. There are a few points from the surgeon point of view we should consider. Number one, when you talk about the patient's concerns, on a general note, all the patient will always have a concern, kind of, I want to get it done in one go, one session, one day procedure. I want to get it fixed both in the front and the crown area. That's what they would simply say. But when it comes to the surgeon point of view, it is not that easy to just fix it in one session when you are suffering from baldness in the frontal area as well as the crown area. That means probably this kind of cases would always need second session. So why do we need second session in that cases is, we'll discuss in detail now, but kindly do understand this is irrespective of the baldness type according to the Norwood's classification. Just kindly take it as a kind of a general thing like front and crown area baldness if you're suffering from when you're opting for the transplantation, provided you got a minimum ways to get it done, provided you got a good donor area. If you're suffering from front and crown area baldness, how do we handle this kind of patients? That's what we're going to discuss. When it comes to the point of surgeon point of view, imagine when you talk about both front and crown area baldness to be fixed at one session, in one session, imagine crown itself, you always need second session. So in this scenario, if you try to implant some grafts in the front and as well as the crown area, I'm sure you're not going to get any density there, because we need to implant considerable amount of grafts in the frontal area to get at least a good frontal look and good side look, and then we need to think about the crown area. That means at least we need to implant 50% to 70 or 80% in the frontal area, almost 30 to 50% in the crown area to balance patient needs. What happens there is, because actually you don't get any density in the crown area, so there is a possibility that your density appears to be very less. Here one more addition. Suppose the patient has a concern that I want to get my lower hairline by a centimeter down, then your transplantation will go to a toss. Number three, imagine if you unfortunately lose more hair in the future with this plan, I'm sure your transplant will go for utter flop. So these are the few situations that we need to understand and plan the transplantation. We can ask me a question. When you're planning for front and back area transplantation, instead of doing 3,000, 3,500 grafts, why can't we do 6,000, 7,000 grafts? This is a question you would get in your mind immediately when we spoke about this. But kindly remember, our donor will not support to get those many grafts in single go. If you try to do that, you're going to harvest overzealously in the backside, ending up with a depleted donor, and no more transplants are possible for you. So one should understand that 95 to 99% of the patients cannot get grafts more than 3.5 to 4,000 in single go from the scalp. This is the most important point to be noted. So second session after 6 months, there is a possibility we can get few more grafts because skin might have healed by then, and we can try to pick up more grafts from a certain area without damaging the donor. So there is a possibility to do second session. So that is the reason we are talking about whoever suffering from front and back baldness, fixing it one session with 3,000, 3,500 grafts. I don't think you would get any density. So these kind of cases always need second session. So well, here imagine if you pressure the surgeon or the clinician or someone who really want to get it done more grafts in single go, probably you can think about getting your beard graft to be done. That's a second scenario, or maybe chest grafts. That part we are not discussing here in detail, but well, we're talking about only scalp grafts today here. In this scenario, if you try to pressure the details, probably most of the clinics are amateur guys who are going to operate on you, kind of they would bluff and say that they did 6,000 grafts. Having said that, how do they bluff saying 6,000 grafts to you? Probably they'll take 3,000 grafts and separate into individual grafts and make over almost 6,000 follicular units implanted in your grafts and your scalp. Looks like very great on first day and even 10th day, but end of the day you don't get any results because they are separating your grafts into single follicular units and implanting it to convince you. So these are the things can go wrong during the transplantation if you go against your clinician or your surgeon. But most of the people, if they are transparent enough to tell you, we would try to explain you that you should not go more than 3,500 grafts, maybe 4,000 grafts. There is an approximate number I am talking about. This is the first mistake that would happen in your consultation if you just pressure on taking your transplant done in one session. So number two mistake is, if someone really wanted to show you more grafts, probably they would separate singles and they will target single grafts itself. This also can damage your donor and your growth also. So these two things can happen when you talk about more number of the grafts in an average donor person. So this shouldn't happen with you. That's the reason you need to discuss with your surgeon in detail what are the availability of the grafts, what are the requirement in my case, what are the best plans. Apart from this, two more things can go wrong. Next one is, imagine you're going to ask, I wanted my hairline down by a centimeter, then you would need almost 450 to 500 extra grafts depending on your scalp size. First of all, we don't have grafts to implant in the front and crown area. If you still bring your hairline down, you are going to end up in kind of a disastrous outcome. So most of the people can walk away from the consultation. They can cancel their procedure when transplant surgeon talks about these details, but that is a fact. So by knowing all these details, you have to make up your plan, because each person's baldness and plan prognosis may vary. It will not be the same. So these are the things we should notice during the consultation and take details from an expert. What are the chances that with this plan I am going to get best outcome? What are the chances that I would not get density? So these are the things we should be understanding well in detail before planning your transplantation. Furthermore, to our discussion, next mistake can happen is, imagine we planned for front and back in one session, and you have taken 1 centimeter down, hairline down, where you are inviting extra baldness, where you would need more grafts. And next, along with that, if you lose more hair in future, maybe down the line, 1 or 2 years down the line, if you lose more hair, what about your transplantation prognosis and what about your transplantation results? It's totally a kind of a disastrous outcome you would get it. So this kind of scenarios, we can't even repair your transplantation. This is another mistake that would happen if someone pressured to get more grafts to be harvested. It's kind of harvesting 6,000 grafts or 7,000 grafts in one go. It's kind of impossible. It's definitely not possible to do get that many grafts to implant in one go, because of many reasons. Not only because of availability, because of time consuming factor, because of the patient cooperation, whatever it is. And most of the patient will ask me, why can't you get more grafts? It's as simple as that. It's impossible. It's not possible to get more grafts because you end up in a depleted donor or damaged donor. There are few calculations, it varies to person, and we cannot get more than 3.5 to 4,000 grafts. It's a rare scenario. Then, if you plan that way, you're going to end up in a damaged donor also as well, and you don't even get the result. That's the reason we cannot get more grafts from the scalp in single go. As we already discussed, it can be done from the beard or it can be done again after 6 months from the scalp. So what happens in the consultation is when you always pressure about I want to get it done single go, I have no time. Of course, you may not have time, even surgeon doesn't have time, but this our body doesn't respond the way you want and I want it. It always goes with the body's response. That means we need to go in that response within that limits only we need to harvest. If I try to over harvest, you end up in a disastrous outcome anyway. So your time constraint doesn't matter for the body, isn't it? So you need to plan according to your needs, according to your goals, rather bringing in your time constraint there. Because here, most of the surgeons or doctors or whoever it is, they don't have much enough time to convince you and show you some visuals or videos what can go wrong with this plan. They don't tell you. They just really wanted to put you across there under their knife and get your transplant done. And at the end of the day, it's all you wish to do this kind of surgery, they did it. They did it. So kindly, you just give a choice to your surgeon to understand what are the possibilities that I can get in my case. So what are the possibilities that I would need second session? Well, what if we plan frontal baldness and crown area in one go, provided patient really has no time with him and is okay to get the what are the results. That kind of video I'm going to show you today. Well, this patient had a concern that he wanted to get it done both front and crown area in one go. We planned it such a way that hairline area, I always wanted to give more density because that is a one kind of an index for the transplant. When someone look at the hairline, the density, volume, bulk in the frontal forelock area and even sides one has to get. That's what we gave him more density in the front, more than 60-70% density in the frontal area. Whereas around 30-40% density, I'm not sure about the number of the grafts, but backside also we implanted. Well, if you can see the results after the transplantation, you got excellent change in the front, sides and mid scalp. Well, in the crown is a manageable density. I'm sure crown alone would always need second session, but well, when you're making it for both front and back, I'm sure you are going to get only this much density or even less. Kindly remember, this patient had a kind of a small size scalp. That's the reason the possibility of spreading the grafts both front and happened, and patient also did not want to go with the hairline down more than whatever we proposed it. If you would have gone with a kind of a centimeter down lower and bigger size of the scalp, I'm sure this is going to become a flop for someone. This turned out to be better for him. Of course, I'm not happy because density in the crown area is still less. This much only you're going to get, probably less than this. So this is the disadvantages of getting done in one go. Now here, of course, you can go with second session if you want to. If someone asks me, can he go with second session? Yes, definitely you can plan the second session even after 6 months minimum gap. That possibility is always there. Well, if you here bring in a beard grafts, second day we can do, and we can implant in the crown area. But since we are restricting this patient and this video only for the scalp grafts, we did both front and back. This much results we achieved it, and probably same results we may not achieve in all the patients if you plan this way. That's the note I wanted to give you. And however, this man is so happy with his outcome. Probably he want to come back with second session later on. That's what he suggested me. He told me. But when someone plans this way, there is a possibility that your crown area you may not get any hair, or you may get reasonably low density. And that's the scenario of this situation of this case after fixing the after doing the transplant with one go both front and crown area. Well, conclusion is if you have a small size scalp and kind of a baldness is small, if you implant both front and back, provided a proposed hairline, not very lower hairline, provided you don't have further ongoing hair loss, then you would get reasonably good density if you plan both front and back, not the best density. Provided you are a very young man and you are losing more hair, if you do both front and crown area in one go, your transplantation will definitely be a failure. Provided if you're taking a hairline furthermore down and implanting it, your transplantation definitely goes disastrous. So, well, these points has to be discussed with your surgeon according to your needs, goals, and according to your age and according to your ongoing hair loss. All this actually varies to person. You have to sit with your surgeon and take a detailed discussion about this and come to the best plan, and then execute that way. You would get the good density. Well, in this scenario, if you can ask me a question, can he go with second session? Yes, he can go with second session after 6 months. What if I do both front and back? I'm okay with getting reasonably good density. I'm okay with getting less density. Yes, always you can go ahead. If you got your second session in your mind, any plan you can make it. That's not a problem. So, well, someone is planning additional grafts on the beard. Of course, second session can be done even next day itself, even after 6 months also. These are the proper scenarios, changes with the patient to patient. Well, you need to talk to your surgeon about your case scenarios and then discuss about the plan, then go with the surgery. For more details about your individualized case, kindly walk in for consultation and take details and get it done. Thanks for watching our videos. For more videos, kindly do watch our channel. Thank you again.